Hi, my name is Emily. I'm going to be your nurse today.
Hi, I'm Sandra.
Okay, I'm just going to close the curtain quick here for some privacy. So, you were recently diagnosed with congestive heart failure, and it says here in your chart that the doctor has informed you about how the word term congestive means that there's a fluid buildup and stuff, and it all comes from the disease. So today I'm going to be teaching you some ways to live with it in your daily life and to kind of have full control over it and stuff.
Okay.
So are there any questions that you had for me right off the bat?
No, not really.
Okay.
Yeah.
So the first thing I'm going to teach you is how to weigh yourself. And I'm going to give you this weight chart here right away.
Okay.
So this is to kind of keep track of your weight every day and see if it's fluctuating or not.
Okay.
Because if your weight is going up, that means that you might be accumulating some of that fluid. So we really need to keep an eye on that. So we're going to come over here to the scale and I'll teach you how to weigh yourself then.
Okay.
Okay, so this is just our standard digital scale that I have here. We're going to be sending this one home with you so that you're familiar with it and you know how to use it.
Okay.
So what you're going to do is you're just going to step on and press that little O spot first and wait for it to zero out.
Okay.
And then once it zeroes out, you can step on. Okay, you can step off. All right. Do you feel you understand kind of how to use that? It's pretty simple. So
Yes.
okay, and you'll be getting the exact same one so that you're used to it.
Oh, thank you.
Yep. Okay, so it says here in your chart that your daily normal reported weight is 180, and today the weight that we saw was 190, so we kind of want to keep a watch on that. It might be that the fluids are up, or it might just be because you've been hospitalized and you haven't been really moving around much, so you've just kind of gained a little weight.
Okay.
The next thing I want to talk to you about is your diet and eating a heart-healthy diet. What are your normal meals? What do they normally consist of?
Mostly for dinners, I have burgers and fries and a lot of soda.
Well, the one thing that we want to consider with congestive heart failure is your fluid intake. Usually you hear that pump the fluids, you want to really drink them. But with congestive heart failure, you want to kind of limit your fluid intake. So with you having your jumbo soda with your dinner and stuff like that, you're going to have to cut back on that. I would suggest taking a water bottle that has ounces on the outside where you can measure how much is in it and filling it up to the 20 ounces that's recommended for you daily.
Okay.
And then carrying that around with you, and when it's gone, and then you should know that, oh, I've had about the amount of fluids I've had today, so I should probably, like, it's okay to have a little bit more, but just know that that's about how much you should have. But if there's times when you're feeling, oh, I'm so thirsty, I really need something to drink, I would suggest taking grapes and freezing them, because then you're kind of getting the liquid and you're kind of quenching that thirst because you're making your mouth salivate. So it's kind of like tricking your mouth into thinking that you're getting a drink when you're really not.
Yeah.
And you should also keep in mind that things like ice cream are considered a liquid because they do melt and stuff like that, and when it's digested through your body, that your body gets rid of it as a liquid. So that's another thing that you should really look against not eating.
Okay.
So I have a handout here. It's Heart Healthy Eating Guidelines, and it has in there the left side is the foods that are recommended, and the left side is the foods that you should really avoid eating. Do you have any questions about what you should be eating and stuff like that?
No. I forgot.
For, like, say, I know you said you like to eat hamburgers and stuff. You should really try to look for a leaner ground round instead of like a real fatty piece, or maybe even consider like a turkey burger, or try maybe elk, because it has a more leaner meat to it, so it's not so fatty and it's better for you.
Okay.
And I also have some more handouts here about eating. Like, here's one about if you're going to a restaurant, like say you're going to a fast food restaurant, it has listed here what you should really look for eating, or you're going out for Mexican, it has listed what you should choose instead of, like, this is the more healthy choices.
Okay.
So I want to practice with you kind of reading a menu and kind of knowing what you should be eating. So this is the hospital's menu that I want to give to you, and now you can practice, pick something out of there, and I'll let you know.
Oh, okay, so for dinner, what if I get a grilled chicken sandwich on whole wheat bun with salad and some diet soda? Sounds good to you?
Yeah, that sounds perfect. That's excellent for a healthy meal choice.
Okay.
I have a couple more here, a couple more handouts. This one's simple and quick low-fat snacks. So if you're going throughout the day and it's like, oh, I could really use a snack right now, that's kind of your healthy choices, and they're quick and easy to make. And here's one for now you're going to be going out and you won't have us as our hospital staff here to make your meals for you. This kind of gives you an idea of what you can eat. It has a whole week planned out there for you. So now when you go home this week, if you're unsure of what you should be eating each day, that kind of goes through what should I eat for breakfast, what should I eat for lunch, and what should I eat for dinner.
Okay.
So another thing I wanted to go over with you was when you should notify your healthcare provider. So I had these handouts made up for you so that you can easily just pin them on the refrigerator. They're nice size and stuff, but they won't take up a lot of room.
Yeah.
So this one's when should I notify my healthcare provider? And you want to notify them when you are experiencing a cough that just won't go away, and if it's real phlegmy, because that might mean that there's some fluid buildup in there that you need to take care of. And you should also notify your healthcare provider if you're feeling real weak, or if you notice that you're there's just symptoms that you haven't had before, that all of a sudden it's like, whoa, where did this come from? And you're kind of unsure. Make sure you call and ask, and we'll be able to help you.
Okay.
And then I have this one. It's when you should go to the emergency room, or if you can't get there, when you should dial 911, and that's if you feel like you're going to faint, or if you have fainted and your loved ones notice, then they should call 911 if they find you. If you are noticing a fast or irregular heartbeats, because that could mean that your heart is doing more work than it needs to be and stuff, and it's really beating fast.
Okay.
Or if you're experiencing like a crushing chest pain. So, are there any questions that you had that you would?
No questions. It's a change in my diet and lifestyle, but I'll make sure I go according to everything you say. So
Okay.
Thank you so much.
And then I just also have this booklet if you ever need to refer to anything, and it also has on the front cover here the number of the hospital if you ever need to call and just have a question. We're always here. We're ready to answer any questions that you have. So feel free to call anytime, even if it's just, whoa, I gained 2 pounds in the last 3 days.
Yeah.
Like, if you ever have a question like that or a little concern, feel free to call us.
Okay, I'll do that. Thank you so much.
You're welcome.
Bye.
Bye.